Welcome, dear viewers, to this talk about a new approach in diagnosing and treating chronic illness and cancer. My name is Eleonora Flach. I'm a naturopath and therapist at Klinik im Leben, a hospital for integrative biological medicine in Greiz, Germany. And today I want to share our insight and experience with you, experience that we've gained in more than 2 decades of treating patients with chronic illness and cancer. And I want to give you some background information on what we are focusing on in order to treat our patients holistically. Here you can see a picture of our hospital. It's taken from the garden next to the hospital, the Garden of Life, and the same building also hosts the Central German Hyperthermia Center, and the hospital is a specialized center for integrative natural cancer treatment, for homeopathy and naturopathy, energy medicine and information medicine, special pain therapy, revitalization and rejuvenation, and biocheck diagnostics. So what is new about this approach? I'd like to use the iceberg model in order to explain that. You all know that we only see 10 to 15% of an iceberg above the surface of the water, and 85 to 90% of the iceberg is underwater. So if we compare this to medicine, when we use general diagnostics and general treatment, we cover the part of the iceberg of the patient's illness that is above the surface of the water, meaning we're dealing with those processes that are easily visible and easily detected. So, for instance, ill organs, inflammation, or tumors. But we want to know what actually led to these issues on the physical level, what influences the body, so the body isn't capable of fighting illness on an early stage. And we see that we need to deal with functional disorders, with an overload of the system, meaning that some organs are just overstrained, weakness of organs, tissues, or muscles. We might be dealing with regulation disorders or harmful habits that influence health, maldigestion or development and accumulation of toxins. It might be environmental toxins that are flushing in, or radiation, or a mental overload, or an emotional overload with certain emotions that cannot be dealt with in a healthy way. So we want to include these 85 to 90% of the iceberg into the diagnostic and into the treatment process in order to get a full picture of what actually has caused the symptoms and the complaints that the patient is presenting with to us. So before we delve deeper, I want to explain the importance of the diagnostic threshold to you. So if we take standard medicine, the diagnostic threshold, meaning when can a disease be detected, is somewhere around here. So on the border of sickliness to illness. Take lab diagnostics, for instance, or imagery. So usually, even in lab diagnostics, some parameters can only be analyzed, for example, some liver or kidney parameters, when already a high amount of the liver or kidney cells is dysfunctional. So standard diagnostics help us identify processes that are going on in the body that are quite acute and quite severe. So to an extent that even lab diagnostics, meaning we're analyzing body tissue, or imagery results are not within the normal range. If we take complementary medicine, we have a different diagnostic threshold. It's a bit higher. So if we take the health index over here, 100% health, we're over here with a diagnostic threshold of complementary medicine, meaning that here we can already start scrutinizing some of the functions of the body at a state of suboptimal or apparent health. And if we use the newest methods, we can even lift this diagnostic threshold higher, and we can use it we could put it somewhere over here, so we can use it for we can use complementary medicine or integrative medicine in order to prevent diseases from occurring, even because we'll be including the level of soul and information and the level of mind and energy into the diagnostic process, whereas with standard medicine we usually analyze only the physical and biochemical level of the body. And as I've explained to you, we want these 85 to 90% of the iceberg of our human health to be included in the diagnostic process in order to get a full picture of what is going on. So that's why we need to know about these thresholds, that of course diagnostics are limited to some extent, and we need to combine different diagnostic measures wisely in order to get this full picture. So, and if we understand how illness develops, we'll understand why these diagnostic thresholds are so important to us. So we have this health index over here, and we have 100% health, perfect health, more or less, individually speaking, of course. And this health status is stable until there is a negative impulse, and then health starts to deteriorate. And it can stabilize again. So now we're on the level of either suboptimal apparent health or on the level of sickliness already, chronic sickliness. Then there might be another negative impulse and health starts to deteriorate further, and then it can stabilize again, but at some point there'll be a negative impulse that kicks off a process that causes severe symptoms. It may cause chronic illness and it may cause cancer. So we don't want to only analyze and treat the patient that is in this situation over here. We want to look back and understand what actually happened and what kind of impulses were these. Were they physical? Were those toxins that flushed into the body and that we need to get out of the body because they are still influencing physical processes? Or are these impulses on the level of mind and energy, or on the level of soul and information that we need to include into the diagnostic and into the treatment process? So this is important in order to find the root cause of the disease, so that we don't keep chasing the symptoms and treating symptoms one after the other, because what we often see in cases of chronic disease is that if we just treat symptoms, if we limit ourselves to the treatment of symptoms, then it may be that they reoccur after a while, or it may be that that the chronic disease or chronic illness the patient presents with comes to a halt, but it may be that something else pops up. So we've seen it multiple times in cases of skin disorders, for instance, that chronic skin inflammation, for instance, might come to a halt, but then we start seeing issues with inner organs, so inflammation of the inner organs, and that's not what we want, to be chasing symptoms and see them relocating. So we actually want to understand, how did we get over here? And for that we need to track back what has happened in the patient's life before, and we need to see whether we can help resolving some of these issues over here. So we've conducted an analysis of test results in order to identify which level of the human body the root cause of disease is most commonly found on. Of course, the root cause of disease is highly individual in detail, but we wanted to know which level is affected the most. So what we found is that the majority presents with the level of biochemistry hosting the root cause of disease, and then we have the level of the psyche, then information, and only then structure, meaning the actual organs, tissues, and so on. And we found that so interesting that we decided to continue this analysis, and we checked for the most impacted level. So the level where we see most disturbances on in our diagnostic checkup, not the root cause, but the level that is most impacted. Again, the level of biochemistry, again followed by the level of the psyche, information, and last one, structure. So, and finally, we've expanded this analysis in order to identify the root causes of regulation disorders. So which level is the level that hosts the root cause of regulation disorders? And we see that number one is the psyche here, followed by the level of biochemistry, the level of information, and the last one again is the level of structure. So we've conclusively seen that the level of structure, meaning the level of tissues, of organs, is usually not the level that holds responsible for the disease. Although those symptoms that are expressed on this level are usually the symptoms that the patient suffers severely from, but the root causes are usually the level of biochemistry and psyche, and also to a great extent information, meaning that on the level of biochemistry we need to look into inflammatory processes, we need to look into vitamin and mineral deficiencies, for instance. On the level of psyche, we need to look into unresolved conflicts and constant stress. And on the level of information, we, for instance, need to look into electromagnetic fields and other issues that influence the human body. So by what actually causes these disturbances on these levels? And I'd like to start with the level of structure. What we commonly see is that we're dealing with tooth foci, so meaning inflammation in the area of the teeth that might have been there for a long time, chronic tonsillitis, chronic sinusitis, or maldigestion. So partly inflammatory processes. And when we're dealing with inflammation, we know that the healthy tissue has less vitamins and minerals available because the sources are depleted in order to fight inflammation. And so these chronic processes that might seem very local actually affect the whole body. They affect the immune system, they affect regulation, and many, many other processes. So when we find such disturbances, what we'll do is we'll start treating them, either with dental restoration, or we can use neural therapy because neural therapy is capable of fighting inflammation. We can use myotherapy in order to help regulation, help the immune system, and of course help restore a healthy gut. And we can use medical colonic bowel irrigation in order to flush out all kinds of toxins that have accumulated in order to flush them out of the body. On the level of biochemistry, we most commonly find environmental pollutants, be it heavy metals, be it toxins originating from exposition at work, for instance, amalgam fillings, allergens, viruses, vitamin deficiency, or mineral deficiencies are very common. So what we'll do is we'll start draining the toxins, we'll start detoxifying using myotherapy and medical colonic bowel irrigation to flush the toxins out of the body. We will start strengthening the immune system with immunomodulation so it can fight the viruses that might be hiding in the body. We will use microimmune therapy and orthomolecular medicine, meaning that we will supplement necessary vitamins, minerals, or amino acids to the patient, because an ill organism often needs more vitamins and minerals of certain kinds than a healthy organism. On the level of the psyche, what we often see is that there are dysfunctional family dynamics, or there is dissatisfaction with profession, or depression or negative self-programming. And what we will use in case we identify imbalances in these areas is quantic healing, which is a information and energy healing method, or we can use family tree healing, timeline, systemic therapy, Lucia therapy, or SOL hypnosis, which is a very deep version of hypnosis that helps resolve a lot of unresolved conflicts for the patient. So this is crucial also in order to treat the disease that the patient presents with, be it chronic illness or cancer, because the level of the psyche, as we will see soon, plays a significant role for the functioning of the immune system and for the functioning of various self-healing processes. And on the level of information, we commonly find issues concerning geopathology. The sleeping place might be affected, physical fields or energy fields that are disturbing the functioning of the human body, and it might be necessary to look into building biology or consult a building biologist. It might be necessary to take protective measures, and we of course also in addition provide energy healing to the human body. So you already see that this new approach is all about taking into consideration all levels of the human being. Of course, the level of the physical body and biochemistry, but also the level of mind and energy and the level of soul of information. Meaning that first we start with the holistic diagnostics. We determine and we analyze which levels are mostly impacted in this individual case, and then we start targeted treatments targeting exactly these issues that we've identified in the diagnostic process. So why do we want to use integrative diagnostics and therapy? We definitely need standard medicine because standard medicine is ideal for precise acute diagnostics and for precise acute intervention. Biological medicine is ideal for the identification and the treatment of root causes, and if we combine both of these, then we get integrative medicine, meaning that we gain an accurate understanding of the ongoing processes, but also an accurate understanding of the underlying causalities, and that's exactly what we need in order to treat holistically. So how is such an integrative diagnostic approach performed? We make use of the intersection of standard and biological measures, and we create a synthesis of both approaches during the diagnostic process, meaning we take the both measures that are available both from standard medicine and biological medicine, and then we get this integrative medical approach, meaning that we gain a holistic analysis of the situation. That's what we call biocheck. So what we do is we look for toxins from all kinds of sources, and we check whether there is a need to detox for the patient. We look at the balance of acids and bases that influences many physiological processes. We take a look at the regulative capacity of the organism, and we take a look at the emotional balance. So in here you can see the new possibilities in the field of diagnostics. So on the level of soul and information, of course, we also use the holistic anamnesis and the physical examination, but we also use a method called quantic and a method called mind link test in order to search for deviations on the level of soul and information. On the level of mind and energy, we use Electro Acupuncture, Computerized regulation thermography, heart rate variability. Quantic can also be used on this level, the Lucia test, and again the mind link test. And on the level of the physical body and biochemistry, we can also use Electro Acupuncture according to Dr. Foll, the cell check or the expanded med check, computerized regulation thermography, the Buffy test, dark field microscopy, the metabolic typing test, and the viscosity testing. So I will not explain all of these diagnostic tests to you now, otherwise we'd probably be conducting this talk for several hours, but I want to present the most important of these measures to you. So let's start off with the mind link test on the level of soul and information. So what we'll need is this SCASIS system. We have a computerized database of 2,500 questions concerning dysfunctions or disruptions on this level of the human being. And these are audio files, so electromagnetic audio waves. And these audio waves are transformed by a Möbius coil to scalar waves. Scalar waves are waves that we can't consciously hear, but they still reach the human body, and the human body still reacts to them, even though we don't perceive them as words. So this is a way of non-contact information transmission. And while this information is played to the patient, the therapist checks the arm length of the patient. So in the beginning, in neutral stage, before testing, we will have an equal arm length. And then the therapist will be testing the arm length after certain questions, and there might be a difference in arm length resulting from a stress response to the audio file that is being played at the moment but cannot be heard. So this is a muscle reflex, and this muscle reflex is used to identify whether there is a there's a resonance according to the information that is being transmitted from the database. And the benefit of this test is that neither the therapist nor the patient are hearing the what is being asked. So this is a very objective type of test, because we don't need to ask the patient, are you, for instance, are you dissatisfied with your work field, for instance, or are there any dissatisfactions concerning your family dynamics? We don't need to ask these questions because we have this non-contact information transmission, and neither patient nor therapist know which question is asked at the moment. And the therapist simply, if the therapist notes that there is a difference in arm length after a certain question, he will just press a button on the computer, and the computer will then register that this was a response to a certain question. So this is a possibility to analyze a very, very large amount of issues that might be inhibiting the functioning of the human body on the level of soul and information. So of course I want to show you an example of the test results. So what we see here is that we have a patient with pain in the stomach and in the abdomen, and we find blockages concerning geopathic stress, the Hartmann grid. The patient was victim of an accident. We have issues concerning chakra energies, especially the crown chakra, and we have a blockage of regeneration. The system not only asks or transmits this inaudible information on blockages, but when we're done with testing all the blockages, we test for solutions. So that may be physical exercise or physiotherapy or psychotherapy, or it might be positive affirmations. And in this case, we have a couple of positive affirmations that can be helpful to overcome these blockages. For instance, the positive affirmation, I am supported and loved, or it's safe to let things go. So let's move on to the next level, to the level of mind and energy. And here I want to show you 3 diagnostic measures: the heart rate variability, Electro Acupuncture according to Dr. Fall, and computerized regulation thermography. So let's start off with heart rate variability measurement. This is not just about counting heartbeats per minute. It's more about the intervals between those heartbeats, because by analyzing these intervals, we receive a lot of information on the autonomous nervous system. The autonomous nervous system, in short, consists of two main parts, the sympathetic nerve and the parasympathetic nerve. The sympathetic nerve is the part of the autonomous nervous system that we need when we need to be alert, when we need to think fast, act fast. We might need to run from danger. So circulation will be increased in the brain, in the heart, and in the muscles, and circulation will be decreased, for instance, in all digestive or hormonal organs. The parasympathetic nerve, on the other hand, is the one that is responsible, for instance, for digestion. So if we eat food, we want all of those micronutrients to get into our body, all those vitamins and minerals. That can only happen when we're relaxed, when the parasympathetic nerve is properly working. Identifying toxins and flushing them out of the body only happens when the parasympathetic nerve is properly working. Hormonal regulation also needs parasympathetic activity, for instance, and many other functions. And this autonomous nervous system, it's kind of an either-or situation. They don't like to work together, those two. So they need to be in balance, obviously, and we use this test in order to check the balance, whether we have a balanced autonomous nervous system. And what we see here, we have a patient with a heart rate of 78, which is more or less normal, slightly elevated, but we have a sympathetic nerve that is far too active. So this patient is experiencing a lot of stress, and the sympathetic part of the autonomous nervous system, this alertness system, is dominant. And the blue one, the one representing the parasympathetic nerve, is not very active. So this is something that we check for, and then we can advise the patient on what to do in order to decrease high sympathetic levels. And this is very important because latest research has shown that a dominant sympathetic nerve triggers or enhances inflammation. We have more metastatic processes going on if the sympathetic part of the nervous system is dominant. So it's really important. It's not just a question of a lifestyle. It's very important for the whole human organism that we have a balance between these two. Let's continue with Electro Acupuncture according to Dr. Foll. So what you see here is how we perform this test. This test uses electric current, and we measure the electric resistance of the human body in certain acupuncture points. This test was developed by Dr. Foll. There are several other systems that are similar, but we have had the best experience with this system. So, and of course, I've also included a test result for you, unfortunately only in German, but I've included the translation over here on the right side. So what you see here, we're checking the liver, the joints, the stomach, the connective tissue, skin, fatty tissue, gallbladder, kidneys, and the urinary bladder. And what we're checking for is whether the organ is working well, meaning that the electric resistance is at a certain level and is quite stable, or whether we have a organ dealing with an overload, meaning that the organ is trying its best to cope with this overload. Then we will have a different electric current or electric resistance. Or is the organ already, or the tissue already exhausted and weakened? We will also see that in the test results. This test can furthermore be used in order to identify which drugs, which supplements, infusions, for instance, are beneficial for the human body. So we will take samples of certain drugs or supplements. We will include them into this testing cycle, and we will see whether the electric current changes or not. And that way we can identify exactly which supplements, which drugs, and so on are ideal for this patient. And furthermore, this test is used in order to identify whether there are toxins in the body, be it bacterial toxins, viral toxins, heavy metals, light metals, environmental pollutants, and so on. This is a very broad spectrum of how we can use this test. Let's move on to computerized regulation thermography. In this test, we're looking for differences in temperature that tell us how well the blood vessels are reacting to differences in outer temperature. The basic principle of this test is a couple of thousand years old. Back then, people were covered in mud, the patient was covered in mud, and then the therapist would check how fast the mud dries over certain areas of the body, and he would deduce from the speed of the mud drying whether this is an area receiving too much circulation, or whether there's an inflammation there maybe that also heats up body tissue, or whether this is an area that is too cold, under-circulated, so to say. We're not covering our patients in mud anymore. We use a different system. So we use a thermometer and we measure all kinds of body areas. The black lines here are those initial measurings, and then the patient needs to cool down a bit for about 10 minutes. The room is at 20 degrees Celsius, meaning it's a little bit less than comfortable room temperature. The body cools down. And what we observe is that in a healthy body, the temperature on the head points will increase a bit, because the body, when there is this sudden change in temperature, will send more blood to the head. That's very logical. That's where our brain is, and we need a functioning brain if there's something strange happening. So the head area should get a little bit warmer. The rest of the body should cool down a little bit, but the head shouldn't get too warm and the rest of the body shouldn't get too cold. And we check whether this happens properly, and this tells a lot about the regulation of blood vessels, for instance, or about inflammations going on in the body, which can also be hidden inflammations, meaning without pain, no visible redness, no visible edema, for instance, but they may be underlying anyway. So and here I have an example for you. You remember the black lines indicate the first measuring, the red line just behind it indicates the measuring in exactly the same point after a phase of cooling down. And the head area should get, the points in the head area should get a little bit warmer due to the regulation of the body. And we see that is the case in many points, but over here, for instance, and here we see a drop in temperature over here as well. So here we conclude that there might be foci in the sinuses and in the tonsils. And indeed, this is a patient that had operation done on the tonsils, and there was still some remaining tissue, lymphoid tissue left after the operation. That may happen. But this lymphoid tissue was still subject to chronic inflammation. So thanks to this measuring, we know that we need to use, for instance, neural therapy. So we need to use the local anesthetic procaine in order to fight the inflammation in these areas. And here we are in the abdomen. This is the upper abdomen, and here the lower abdomen, and I want to show you this point over here. So this is the initial measuring, and you see how far the temperature drops after the phase of cooling down. This is the point of the small intestine, And when we see such deviations from the normal regulation, from the normal temperature regulation, experience shows and analysis shows that we might look into food intolerances. So if we see this result, and if we see in the Electro Acupuncture, according to Dr. Foll, that there are certain foods that cannot be digested well, this is more than a hint that we're dealing with food intolerances here. And food intolerances, of course, influence gut bacteria again, and gut bacteria influence the immune system, for instance, the hormonal system, and so on. So then we'll need to deal with these food intolerances over here. So we've also carried out an analysis among the results of the computerized regulation thermography, and what we see is that the sinuses are affected in 88% of all cases, and the tonsils in 77% of all cases. And we need to check for silent inflammation here. So if there are chronic issues with running nose or stuffed nose, for instance, or recurring issues with swollen throat, for instance, we need to check whether there is silent inflammation happening here. In 72% of the cases, the thyroid is affected. And in 68% of the cases, we suspect craniomandibular dysfunction. That means that the joint over here, the jaw joint, is affected. And what happens is that when this joint, for instance, because the muscle tension in the jaw area is too high, then the lymphatic system, the small lymphatic capillaries, and then also the lymph nodes in this area are compressed by overly thick muscles, so to say. And then we do not have an ideal drainage that is performed by the lymphatic system that drains all kinds of toxins from the head area. The pancreas is also affected often in 62% of cases, the gut and the liver as well. So now let's move on to the level of the physical body and biochemistry. And I want to introduce you to 4 kinds of diagnostic measures that we use amongst others on this level, being the Buffy Test, which analyzes the acids-bases balance, dark field microscopy, the cell check, which analyzes the availability of vitamins and minerals inside the cell, not just in the blood, and also analyzes whether there's a toxic load with metals, for instance, heavy metals, and extended laboratory analysis. So what we see here is the result of a Buffy test of a patient of ours, and this is quite a standard picture in cases of chronic illness and cancer. So what we do, we draw blood, and we have this blood sample of the whole blood, and then part of this sample is centrifugated, which means we separate the blood cells from the plasma. So what you see here, the red line over here, these are the results for the whole blood test, and the blue line are the results for the plasma testing. So what this is about, we measure the pH value of the blood, which means we check how acidic or how basic are these liquids. And for whole blood, there is quite a narrow ideal range, which is 7.34 to 7.43. This is quite a narrow range, and it makes a lot of sense. The body tries to keep this range upright as well as possible, because if the blood becomes too acidic, then this might affect cell membranes, it might affect proteins that are transported in the blood, and so on. It affects a lot of processes that are going on. So what we're looking for on one hand is whether the liquid is the whole blood or the plasma is more or less in this range. It usually is, because the body really does everything to keep this balance. But what we also check for is, are there still buffer substances available if there is an excess influx of acids, for instance? So where do acids come from? Acids form, there's an excess formation of acids, for instance, when there is a bad sleep or too little sleep, alcohol, nicotine, too much white sugar, too much white flour, for instance. Stress also increases that there's an excess of acids forming in the body. So what the body does, it uses minerals, for instance, to buffer these substances. They are basic minerals, and they will attach to these acids, and that way those acids cannot damage any structures in the body. And so there should be a good reservoir of bases available in case there is an excess of acids coming up, and that's what we're checking for here. So what we do is we add a little bit of acid to both the whole blood sample and the plasma sample, and then we measure the pH value again and again. And what you see, of course, here is that the liquid becomes more acidic. It makes sense because we're adding acid, but there is, again, a normal range. So if there are enough buffer substances in the blood, then the pH value will drop, but it will drop more slowly. And what you see here, this light gray line, is the line where the whole blood results should actually be. So you see, yeah, it gets more acidic, but slowly. And what we see here with this patient is that we have a very fast drop of the pH value. And for the plasma, the same is true. So you see this dark gray line over here, and the blue line is what this patient is presenting with. So there are not enough buffer substances in the blood. And this also means that with time, the body, if there are not enough minerals that it can use to buffer these acids, it will start using other sources of minerals, as for instance bone tissue, because bone tissue consists of calcium and phosphate, and phosphate can be used for buffering. So this is something we observe over here, and this means what we need to do is, on one hand, we need to improve the acids-bases balance on one hand by decreasing the amount of acids forming in the body, and on the other hand, we need to see to a good supply of the body with minerals that it can use for buffering, because obviously, as in this case, the sources are depleted already. Another method that we use in order to assess the functionality of the physical and biochemical level is dark field microscopy, also called vital blood microscopy. For this test, we need a few drops of blood from the patient's finger, and we analyze them under a special dark field microscope. What you see here, these cells, these are the red blood cells. They should be perfectly round, and they should be uniform in size. So what we're looking for are deviations, and we see, for instance, that some of them are also clotting together, are overlapping. And we also see that they are not ideally round, and we see differences in size. So differences in size may have to do with a lack of certain vitamins and minerals. When they are not perfectly round, this gives us information on the membrane of the red blood cells, which is built up from lipids and other elements, and that means that we might have issues concerning the lipids in this case. We also see this overlapping, and overlapping means that the red blood cells can't transport enough oxygen. That's one of their tasks. They bind oxygen to their membrane and transport it through the body to the various tissues and organs. When they're clotting together, of course, there's less space for the oxygen to attach to, so we experience that organs are not receiving enough oxygen, which also may cause fatigue. And that's when we'll start looking into the need for specialized forms of oxygen therapy as intermittent hypoxia-hyperoxy therapy that I will mention later. You can also see these white webs. That's fibrin. Fibrin is a substance that the body needs in order to tighten or close wounds, also micro wounds. And when we see a lot of fibrin in the blood, that means that there is a tendency towards inflammation inside the blood vessels. So the body is producing more fibrin in order to close all those micro wounds that can be caused by inflammation. So that's something we'll be looking into here as well. And then depending on the shape of the red blood cells, there may be hints concerning liver issues, for instance. We can also see white blood cells in dark field microscopy, and we'll be looking at, for instance, how fast they're moving, or how well they are working, how well they are granulizing inside the cell. And that gives us information on, for example, how fast the immune system reacts when there is an attack by viruses or bacteria, for instance. The immune system needs to react quickly and attack the intruders, and we can see how fast the immune system is reacting to intruders by watching these white blood cells. So these are a couple of examples. There is much more to see under the dark field microscope, but that's should be enough for now. So in this test that we conduct here is used to analyze the amount of minerals that we have inside a cell. Because what is usually done is that the status, the vitamin and mineral status, is analyzed in the whole blood or in the plasma or in body liquids. But that doesn't mean that that amount that we find there is the same amount or the same concentration that we can find inside the cells, because ultimately we need magnesium, we need copper, we need all of these minerals inside the cell as well. But for that they need to pass the membrane, and there are specific channels that they need to pass to get inside the cell to perform their tasks inside the cell. And this doesn't always work perfectly. So sometimes we can see that in the blood we have enough minerals, but they don't arrive inside the cell. So this is why we're conducting this test called cell check. We use the device that you can see in the upper left picture. It's a spectrometer, and the way it works is that it uses light waves. It emits light waves at a defined wavelength. And these light waves enter the cells within the skin. And the minerals inside these cells, of course, absorb part of these light waves, and the rest is reflected. But each mineral reflects the waves at its own wavelength, so you can kind of compare it to different kinds of mirrors, for instance. So there are mirrors. If you have a completely flat mirror, it will reflect your image this way, so pretty much the same you are. And if you have a mirror with a slightly different surface, it will reflect the light waves differently. And the spectrometer, again, measures the amount and the length of the light waves that are coming back, that are being reflected, and compares it to a database. So we enter that, for instance, female, 45 years old. Then we have a database telling us what the normal ideal range would be, and then we compare the values of the patient, the results of the patient, with this database. And what we see here are these results for these minerals. Unfortunately, this test only gives us the results in German, but basically we have calcium here, magnesium, and so on. And what we see here is when it's in this middle range, more or less, then that's the ideal range. Then if it's a little bit less or a little bit higher, it means that we have a slight deficiency or a slight overload. That may also happen, that we have an overload inside the cell. And if it's in the red area, over the red area over here, we have a high deficiency or a high excess of those minerals. So this is very crucial to us in order to assess whether the patient actually needs supplements, because some patients arrive with bags and bags of supplements that also cost quite a lot of money. That's also something we need to consider. And it might be that the body doesn't need these supplements, so that there is enough of these minerals circulating in the body, but they're not getting into the system, they're not getting into the cells. So then we actually need to work more with the reasons why these minerals are not getting into the cells. So this is an additional test that we're using that's very helpful. What we also use the cell check for is to check whether there is an excess accumulation of toxic metals in the body, be it light metals such as aluminum or heavy metals such as quicksilver or lead. If we have large quantities of toxic metals accumulating in the body, on one hand, the eliminatory organs will be strained, of course, because they have more work to do. And if they can't cope with the situation, then tissue may be damaged. For instance, some of these metals influence, they work as endocrine disruptors, so they influence the hormonal system, or they influence the neural system. They can influence the brain, for example. So that's what we'll be checking for here. And if we find high loads of toxic metals, we need to find ways to get them out of the body. So in some cases, we can use plants, minerals, and other plant extracts, for instance, to achieve that. In some cases, we will need chelation, so those are special infusions that are capable of binding these toxic metals, and then they can be flushed out of the body without causing damage, if done properly, I must say. But in severe cases, it might be necessary to run several chelations. According to environmental medicine, that's what research also shows. In severe cases, it might be necessary to run a couple of those treatments. Extended laboratory analyses are also used. For instance, the chemosensitivity assay. It's based on a simple blood test. We draw a blood sample and send it to a specialized laboratory. And what they do is they assess the reaction of chemotherapeutic drugs on circulating tumor cells. So in cases of cancer, you find circulating tumor cells in the blood. And they filter these cells out of the blood and expose them to chemotherapeutic drugs. And they can assess which chemotherapeutic drug has the highest effect on these cancer cells. They can also assess which chemotherapeutic drugs are these cancer cells resistant to, because cancer is a race against time and we don't want to waste time. So we want to find the individual treatment, the individual drug that targets the cancer cells in this individual case best. So that's what this test is used for. And apart from that, they can also expose the tumor cells to radiation, to hyperthermia, which means overheating, or to biological substances such as artemisinin or high-dose vitamin C. And they can see which treatments target the cancer cells best. Liquid biopsy is also based on a blood sample, and in this case, the tumor load is assessed. So the higher the tumor load in the body, the higher the amount of circulating tumor cells will be. And so this is good to assess the tumor load initially before treatment, for instance, but also for monitoring purposes. So to see how well is the treatment targeting the disease actually, so the amount of circulating cancer cells should decrease in the course of the treatment. APO10 and TKTL1 are used to assess the aggressiveness of the tumor, and again they're also used for monitoring purposes, as well as M2PK. It's used in order to monitor tumorous diseases, but also inflammatory diseases such as inflammations of the gut. Epstein-Barr virus is a virus that can cause cancer, it can cause immune deficiency, it can cause chronic fatigue, it can cause neural symptoms, and that's why we test for this virus, not only whether there is an acute infection or was an acute infection recently, but we have seen that even if the infection occurred many years ago, If there is still some virus persistent in the body, this can lead to disruption of certain processes in the body, and that's where we will also start a targeted treatment against these persistent viruses. The inflammation index is more of a bundle of parameters that is used in cases of chronic inflammation, so be it chronic inflammation of the thyroid gland, be it the gut, be it skin, be it the pancreas, or rheumatic diseases concerning the joints, that's where we use this index. Oxidative stress is also assessed in cases of inflammatory diseases and in cases of fatigue, loss of energy, because if oxidative stress levels are high, we need a lot of vitamins and a lot of minerals that will work against this oxidative stress, and they will again not be available in order to fight inflammation. So that's why we check oxidative stress levels as well. We check the gut flora, because if we have the right amount of healthy bacteria in our gut, they help us fight inflammation, they help our hormonal status, they help producing vitamins, for instance, that are also important for mental health and brain functioning even. And if we don't have the right amount of healthy bacteria, then we can have an overgrowth of pathological bacteria that, on the other hand, will foster inflammatory diseases, for instance. So that's why we check for the gut flora as well. The white blood cell differential is used in order to assess the status of the defense system, so to see how well does the immune system function. Vitamin D as well is very important for the defense system and also for mental health. That's why we always check for the status of vitamin D. So now I've presented a couple of our diagnostic tests to you, a little excerpt. So what do we do now? So we've analyzed the situation by speaking to the patient, checking what kind of results, test results, imagery there has been performed before. We have done our additional diagnostics in order to see what are the correlations to other health concerns, what kind of underlying causes can we find, and the third step is now the individual step-by-step therapy. And I want to present a couple of our measures that we have here for our patients. So this is a model of the step-by-step individual therapy. So what we do is we need to work with negative mental states because they can affect the autonomous nervous system. And as I mentioned earlier, the autonomous nervous system is very important for regeneration and for elimination of negative substances. And we also need to support the body in emitting toxic loads, for instance. We need to activate the self-healing powers, so concerning the metabolism, concerning the defense system and the nervous system, in order to achieve stabilization. And we transform the cause of disease into a catalyst of health. So by performing these very detailed diagnostics, we know exactly which areas we need to work on, and by targeting these areas, they will in turn help us improve the disease, the status of the disease that the patient is presenting with to us. So a measure that we use in order to transform the causes of disease into a catalyst for health is homeopathy. Homeopathy is basically applied toxicology. Substances that at high doses, at high levels, would be toxic for the human organism are used at very low doses, or sometimes even only the information of the remedy is used, in order, for instance, to reduce side effects. So it's highly effective in cases of side effects from chemotherapy or radiotherapy, or in cases of side effects from prescribed drugs. We use homeopathy also very efficiently in order to flush out toxins out of the body. So for instance, heavy metals or environmental pollutants such as pesticides, herbicides, and solvents and so on that can accumulate in the body and stay there for years, and also work as endocrine disruptors. They can cause and trigger inflammations, for instance, and homeopathy helps flush them out of the body. We can also enhance organ functioning. For instance, if we've seen in our diagnostic checkup that the liver or the lungs need some support, we will select the matching homeopathic remedies. It serves as a complementary treatment in cases of inflammation, chronic disease, or cancer. And it balances emotions because you might know this quote, form follows function. We first need to have an idea of where we want to go, how we want to develop, what health status we want to achieve. First, we have an idea of it. And homeopathy helps conjunct the physical body with this idea that we have, with where we want to go, what we want to achieve. So that's what we need in order for the self-healing powers also to be activated. Holographic frequency therapy is a treatment we use in order to enhance cell communication. So cells communicate between each other. They tell each other, I have a virus, watch out. Or they can tell each other, there's some inflammation happening here, let's do something about it. And in cases of chronic diseases or cancer, we often see that cell communication is disrupted. And holographic frequency therapy helps balance the cell communication by using a 3D hologram between two sound converters that are built around the patient. And they emit natural ball-shaped sonic waves that reach the cells from all sides. And certain frequencies are used in order to reorganize cell communication between malfunctioning cells. But the healthy cells in the body are not affected at all by these ball-shaped sonic waves. So that's why this treatment only targets the malfunctioning cells, and the communication between them is enhanced. A tool that we use for emotional liberation is SOL hypnosis. This is a treatment that we use when we observe during the diagnostic checkup that there may be conflicts concerning the soul or the mental state that pose an obstacle to the self-healing powers being activated. So these can be unconscious burdens, for instance, or conflicts within the family, or concerning work or goals in life that draw a lot of attention, a lot of energy, and once they are solved or dissolved, this attention and energy can go into healing the disease that the patient is suffering from. So this is a state of deep trance that the patient is guided into by the therapist. But beforehand, there's a long conversation where patient and therapist write down what the goals of the patient are, because it doesn't make sense to suggest achieving goals that are not individual to the patient. So they will discuss what the goals of the patient are, whether the focus should be health or self-love or self-care, for instance, or changes in goals in life. And what happens in this state of deep trance is that unconscious burdens, such as unconscious negative beliefs or traumatic experience, are dissolved in this state of deep trance. And afterwards, the patient connects to an individual source of energy. So instead of being depleted from his source, depleted from energy by these unconscious burdens that the patient has been carrying around with him for a very long time, maybe in some cases, the patient is connected to an individual, very individual source of energy. So this SOL hypnosis is kind of a toolkit to broaden the personal scope of possibilities. So instead of focusing and trying to kind of find a compromise with all these conflicts that might be occurring in the patient's life, this SOL hypnosis opens up possibilities new perspectives, new ways of perceiving situations, of acting in situations, and not being tangled in old belief systems or old behavioral patterns anymore. Hyperthermia and fever therapy are treatments that increase the body temperature. Hyperthermia, as in whole body hyperthermia or local hyperthermia, reach the therapeutic effect by using devices, as you see here, for instance, the device of the whole body hyperthermia. And fever therapy is used in order to raise the body temperature by injecting specific substances that increase the body temperature. The effect of these heat procedures is that they modulate the defense system. They help with pain, they help detoxification, they help inhibit tumors, especially if combined with additional treatments such as standard treatments, be it chemotherapy, for instance, but also integrative treatments such as infusions containing tumor-inhibiting substances. So these are treatments that need to be carried out several times. There is a course of treatments that needs to be undergone, and we see that it is highly effective in cases of chronic illnesses and cancer as well. So I've already mentioned that infusions can be used in cases of chronic illness and cancer, and I want to present a couple of the new infusion schemes that we are using. So in order to strengthen the defense system, we use high doses of vitamin C, for instance. Vitamin C cannot be absorbed orally at high doses. That's why we apply it IV at doses of 7.5 grams or more. Curcumin is an extract from turmeric and has anti-inflammatory properties, tumor-inhibiting properties. It helps in cases of pain, chronic inflammation, and it helps with detoxification. Artemisinin is also derived from a plant and also strengthens the defense system, as well as amino acids such as L-lysine and L-arginine, minerals like zinc, and vitamins as the B vitamins. For pain therapy, we use procaine cluster. Procaine is a well-known local anesthetic drug, and if it forms a chemical compound, its bioavailability is prolonged, and it helps in cases of chronic pain, for instance, but also acute pain. We use DCA, DMSO, and curcumin that I already mentioned in pain therapy, as well as injection or as an infusion. In cases of chronic inflammatory diseases, we use procaine cluster because it also has anti-inflammatory properties. We use curcumin and minerals and vitamins such as selenium and B vitamins. In cases of fibromyalgia, we again use procaine cluster and a vitalization infusion that consists of several different compounds that form synergetic effects. In cases of dementia, we use NADH. We have a special infusion called power infusion, the B vitamins and amino acids such as L-carnosine. In cases of depression, also procaine cluster can be used, B vitamins, then balance, which is targeting the autonomous nervous system, and levocarnitine. If we detect severe acidosis, we will use the procaine base infusion, meaning that procaine is combined with bases in this infusion. For detoxification, there is a base detoxification infusion, DMSO, and compound infusions containing various substances that detoxify and help with oxidative processes. In case we need special detoxification, so in case there is a very high load of heavy metals or pollutants, for instance, after removal of tooth fillings, we use DMSO and this special detoxification antioxidant infusion, but it might be necessary to conduct apheresis as well. And for tumor inhibition, as I already mentioned, we can use high-dose vitamin C, curcumin, artemisinin, DCA, and several other substances. Interval hypoxy-hyperoxy therapy, or also called intermittent hypoxy-hyperoxy therapy, is a treatment that targets the mitochondria. The mitochondria are kind of the small power plants inside each cell. They produce ATP, which is the energy that our body needs for all kinds of processes in the body. You could also call this a form of advanced oxygen therapy. And what it does is it stimulates the production of new mitochondria, strong mitochondria that will produce enough ATP, and damaged and dysfunctional or old mitochondria will be dissolved in the process. In cases of anemia, it stimulates the production of new red blood cells, and in cases of acidosis, it will help the lungs eliminate acids. And we use a hypoxic and a hyperoxic stimulus in this therapy, meaning that there is a mask that the patient gets, and while the patient is inhaling the air, we add either a little bit more oxygen than the body needs, and then a little bit less oxygen than the body needs at intervals, at certain intervals. And this makes the mitochondria react because they are linked. So the work of the mitochondria is very closely linked to the abundance of oxygen in the blood. So that's how this treatment stimulates exactly these little power plants inside the cells. So now I've shown some of the new and innovative treatments that we use at our hospital, but I also want to mention that we use some traditional methods as well, because what we've seen is that we have the highest success rate for our patients when we combine different treatments. Not all of them, of course, but if we find the ideal individual combination. So amongst others, we use, for instance, acupuncture in cases of pain, or in cases of neurological diseases, or in cases of regulation disorders. We use colon and liver cleansing in order to help the eliminatory organs. We use dietary counseling because in some cases of chronic illness, it's necessary to consume some foods a bit more and others should be consumed a bit less. We use massage, of course, in cases of issues with the muscles, but of course also to enhance the eliminatory capacity of the skin. We use breath work or breathing therapy to improve the regulation of the autonomous nervous system. We use plants, for instance, spagyrics or plant extracts. We use neural therapy as an anti-inflammatory method. We use kinesiology and Bach flower therapy, especially when we need to work on the levels of the soul and of the psyche. We use lymph therapy, magnetic field therapy, psychosomatic medicine, osteopathy, meditation, qigong, energy healing, and Reiki, amongst others. So, and on the pictures, you can see where the hospital is located. On the upper left picture, you can see the surroundings of the town. So there are fields and forests and lakes. It's a beautiful, very quiet region with very high quality of air. On the lower left picture, you see the interior of the patient's rooms. So you can see that we use natural materials. They're toxin-free and pollutant-free, and we care about minimizing the amount of electrosmog. We use filtered water. Food that is served in the guest house is organic and local, and so we try to create a very comfortable atmosphere for our patients, because we believe that only when you feel relaxed, when you feel comfortable, can the body step into this, what I mentioned earlier, parasympathetic state that allows healing. On the upper right picture and the lower right picture, you can see the Garden of Life, and we have created the Garden of Life with like small islands where the patient can sit and reflect on some of the treatments that the patient has gone through, and just relax in the sun and enjoy the fresh air, and the river is not far away as well. So I hope this has been a good insight for you into how holistic treatment can be organized and how it should be set up. So it should be set up after conducting thorough diagnostics, after analyzing the individual situation for the patient, and after creating an individual treatment plan. So let me sum up what we've learned now from this talk, that this new approach allows us to identify root causes and triggers of chronic diseases and cancer, and that these root causes and triggers are most commonly found on the biochemical and the emotional level. We've learned that besides supporting the immune system in general, the eliminatory organs and the emotional balance need support as well, meaning that the key to holistic treatment and the key to not only treating the symptoms but also the underlying causes is a personalized and individualized approach, meaning that we identify the dysfunctions, we identify all the issues that this person is carrying, and then we start treating exactly these issues, meaning that we're treating the whole human being and this individual being. I'd like to thank you for your attention. I'd like to thank you for listening, and I hope that you find some of this information useful for yourself, whether you have a chronic illness or not. We've seen now that paying attention to those 85 to 90% of the iceberg under the surface of the water can be crucial in both treating diseases, but also, of course, in preventing diseases. So I wish you all the best on all levels of your human being. I wish you balance and harmony and all the best for your health. Goodbye.